In our particular market, Great Falls, Montana, we serve a population that's largely Medicare, so 53% of our patients are covered by Medicare, Medicaid 11%, and then when you add in Native Americans from the reservations and Indian Health Services and some of the military folks, our total governmental payers are 70%. And amongst the governmental payers, Medicare is the best of the governmental payers. So when you think about it, if 70% of your business is governmental and you cannot break even on governmental reimbursements, it's not a very good thing long term for your organization. What we wanted to do with the employees was have them understand why we really needed, as an organization, over a multi-year period to get to Medicare break even. We didn't want them to worry that there were going to be layoffs and benefit cuts and pay cuts and no raises. So quite a few years ago, we put into place kind of a pledge to our employees that while we want to pursue aggressive productivity standards, we want people to be comfortable that we will not have a layoff, and we made that a promise. Every year you'll get a raise, and we've kept that promise, and we won't be slashing, cutting your benefits, and we've kept that promise. We have had increasing employee morale, not decreasing, as one might expect could happen. So it's a promise and a commitment to our employees that has worked out well and served us well. And it's nice when you don't have to worry about, is there going to be a layoff coming? Am I not going to have a job? What's going to happen to my family? So we think it's important. Well, while productivity is one of the bigger single things you have to address, the other side of cost, there's another 50% of costs in an organization that aren't productivity. About 20% of the costs, so if 50 is labor, about another 20% is supply chain, the supplies used in an organization. And we did a national RFP and looked at all the different group purchasing organizations and did a series of negotiations, and we switched over to a company called MedAssets several years ago, and they've been a good external partner to us and helped us further reduce our supply costs. So that's an example there. Then there's still 30% beyond that. We look at every single contract within the organization. We look at utility costs. We look at every dollar we spend on everything. And so on those other 30% of our costs that we look at, our motto is leave no rock unturned. Medicare break even, if you're going to commit to it as an organization, you're committing to a marathon race, not a sprint. And for any organization, basically, it's going to take a number of years of concerted effort. And it took us 4 years of concerted effort. You can't maintain a concerted effort within an organization if the leadership doesn't start at the very top and the commitment at the very top. So, it was my commitment from day one. It was the senior leadership's commitment from day one, and we were never wavering on that. If you're losing 25% on Medicare, like we were when we started, I think you think, well, there's no way we could get to Medicare break even. And so, it's almost a task too big to take on. That's why I think you have to have that multi-year mindset and just know right up front, well, of course we're not going to get there in 1 year, maybe not in 4. But if we stay with this, we'll do it. And there are other people that break even on Medicare. Not very many, but at least somebody does it. And yes, I think if organizations deploy the same kind of commitment and methodologies that we have, anybody can get to Medicare break even. Just don't allow yourself to be talked into, it can't be done, we're different, we can't do it here. There's a million excuses you can make, but it can happen.